went on a search really around the world for a company and an entity who was in the prevention and wellness field, who had a demonstrated track record, fewer claims and thus lower cost, better health care of an individual. I kept coming back again and again to Vitality.
We felt we needed to build an organization that had a very powerful impact on people's lives. And so all of these ideas kind of coalesced into the simple idea of, could we get people to live a better life and be healthier?
It's a great example of innovation from a developing country now being accepted as the standard worldwide for how one needs to start thinking about wellness and health.
It gives our life insurance models the ability to be more dynamic on the pricing side. If people manage their health, the price comes down.
The Vitality approach of having incentives, of affirmation of good health has worked.
It's about allowing people to reorganize the incentive structure and basically incentivize at the moment something better for them.
We can see the effect on their health status, and then we can see the effect on the insurance system that we've wrapped around them.
But it's been demonstrated over the last 10 to 15 years in populations in South Africa and now in the United States and in England is this carrot-based approach, this incentive-based approach where you reward positive constructive behavior will actually change behavior.
You want to create these incentives that are powerful and immediate and people think about them. Your health information with your supermarket purchasing, it's an incredibly powerful and useful thing to do. I think the key strength of Vitality right now is the data collection and willingness to do experiments.
What struck me was the enormous investment in actuarial science, behavioral science, sound economics. Pulling this together through the framework of Vitality has really meant that they've been able to make progress that we haven't seen anywhere else.
And we've done a number of studies across cross-sectional studies, longitudinal studies with researchers from Harvard University, from the University of Cape Town and others, and a number of papers have been published. We've done a lot of work on the effect of Vitality. I think the effect is directionally one way. The more people engage, the lower their healthcare costs, the better their mortality levels that they tend to exhibit.
Everybody I met is very excited about doing research, trying to evaluate and trying to understand. Does it work and how can we improve it?
The progress that Discovery and Vitality has made has now been acknowledged by many of the leading writers in both the business and the news sectors.
People around the world are looking for programs that have a demonstrated track record in the sense that a population becomes healthier. There are fewer days of absenteeism with an improved productivity.
One of the great strengths of Vitality is that it is an integrated program, and then looking to see how you could develop prevention and encourage people to take responsibility for themselves.
Vitality is a fantastic idea, and one of the things that make a massive difference to people's lives are health clubs. So we invest in building a lot of health clubs all over the world. It's a good thing to do, and as often happens, when something's a good thing to do, it's a good business as well. I love to stay healthy by setting myself challenges. So, the year before last, I ran the London Marathon. Last year, I did the triathlon, and they've also persuaded me to climb the Matterhorn later this year. So by setting ourselves challenges, we then obviously have to get down to the Virgin Active health clubs in order to get fit and healthy, in order to fulfill those challenges. Vitality and Virgin Active have a very, very close relationship, and one helps the other, and even more importantly, together they help our wonderful customers, who I think have been so loyal to Virgin Active and Vitality over the years.
Vitality has some absolutely unique things that a lot of people are talking about. In fact, governments are talking about.
For the first time, we've seen an unprecedented awareness of governments, of the private sector around the world, particularly fueled by the World Economic Forum, bringing them together under major wellness programs, all saying that this is a future set of epidemics which we really don't need to see unfold at the rate that they are.
And the search that governments are having and that companies are having, that insurance companies are all having, is how you find a company that can lever whatever they offer in a way that will have increased prevention, lower healthcare costs, and better healthcare. The entity that increasingly countries are looking to across the world is Discovery. is Vitality, a program that has over a decade of experience in lifting people up in terms of better health, affirming and encouraging better and healthier behavior, and over time lowering healthcare costs.
Live life well.
Live life well.
Live life well.